I am diabetes, I am not your friend. I think it's time for this thing to end. I was with you.
Diabetes is
long
something that
time
men,
ago.
we have to talk about from time to time. It's very common in our society. It's very common in our race as well. And in particular, Grenada, what we've noticed over the last couple of years is that the prevalence and incidence of diabetes among men is increasing significantly. And it's men across all strata of the society. It's not just the guy who wanders along the street and unemployed, but also in the middle upper class and people who are very busy with the day-to-day work.
Many people ask me, but when we look at you, right, you don't look like a diabetic. You see, living with diabetes for 20 years, but you look physical. You're slim, like you don't have a tummy, and so on, like other people.
We as men need to understand that diabetes do not just suddenly appear on you one day. It's not like a magic, you put a light on and the light comes on. It's a sustained damage to your blood vessels and your vascular system over many years that eventually manifests itself in one day. You'll find that your blood sugar is actually elevated.
When I went to do the test, it was 236, right? And the doctor even make a joke with me. I just always remember that joke. He said to me, welcome to the club of sweet men. And so and from there onwards, he put me on medication, which I never knew that I would have become, put it like that, a diabetic so soon in my life. Because from a genetic standpoint, yes, my father died at the age of 55, and he died from an amputated leg in the earlier part in his life and so on. But I still felt that I would have lived longer. Before from a genetic standpoint, to actually have been identified so early at the age of 38. I'm about to take 60 now.
And you got to be proactive. You got to take a part in the management. You don't just sit down and just take everything that's thrown at you. Diabetes is not a death sentence. You can prevent the complications of diabetes by meeting the therapeutic or the treatment goals.
One of the insidious complications of diabetes that we as guys need to just address and speak to is the problem of erectile dysfunction. Diabetes has the ability to damage your blood vessels, and if it damages your blood vessels, you have difficulty and causing cholesterol and plaques to be built up. That actually prevents the blood vessels from being engorged and strong enough to be able to maintain an erection. If as guys we're serious about our life, I'm not saying other things is not important, but very early you start recognizing that something is not too right with your erection. This is a very early sign that you might be going down the road and path of developing diabetes. You probably might be pre-diabetes, for want of a better term.
If your parents, grandparents, or close family members, they do have diabetes, the study is showing that a minimum of 5 days a week, you exercise for a total of 30 minutes a day, and also the diet, a low saturated fat diet. And you can prevent type 2 diabetes. You can prevent the genes from surfacing.
To be honest, I did make some lifestyle changes. One of them was the whole question about continuing exercising. Yes, because I am a farmer also, so I do a lot of gardening in the country and so on, and I walk and so on. But yet, my blood sugar still does not be controlled without having to take the medication, because I does not watch my diet. I will be very frank and so on. I don't manage it properly. I eat anything I want to eat and so forth, right?
One of the great things for us guys is the power that early knowledge can help to reverse and prevent certain things. You may have the risk factors, you may have the genetic predisposition because of your parents or whatever reason to become diabetic, but as a gentleman, we check early and you find that you start showing signs of early onset. We can do what we need to do, not only to reverse but to prevent the onset of diabetes in the first place.
The first thing I would want to advise whoever, or if I have to actually live again and so on, I have to go through that process, is to first of all, accept the fact or get to know my family history. To know that where if there is any person within my family that living with diabetes or die from diabetes, whether it's a grandmother, a grandfather, and so forth, right? To get to know that, and then now you should be able to know that we have the consciousness about pre-diabetic, go and do all the tests.
The Grenada Diabetic Association is open from 8 to 4. It's Monday to Friday.
There's not a lot of people in here. You don't have long waiting lines. You can come in and get your blood checked for diabetes.
Join the association, just like what I did, because I can tell you, I believe the majority of the knowledge I have of the disease is becoming a member of the Diabetes Association.
Diabetes does not like you. It is not your friend. Get to know more about this enemy.